Dentistry, first of all, is a great profession. I think it's a fantastic career to embark upon. But I would, first of all, definitely recommend getting some work experience. Go and spend up to a month in different dental environments. You've got a general dental practice in primary care, you've got the hospital settings, you've got community settings. And I think the more experience you get, you'll have a really good, broad understanding of what dentistry has to offer. I don't think it's something that you should just walk into without having prior experience of what happens day to day, because it's definitely not for everyone. It's a very challenging career, a very rewarding career, but very challenging. In my personal opinion, I think it's one of the toughest professions to be in. Dentistry is a science, it's an art, and you're on a never-ending journey of learning. And ultimately, you're dealing with people that are more more scared than happy when they come to the dentist. And you have to have the ability to communicate with people, understand them, connect with them in a very short frame of time, and then develop the confidence to allow them to lie back in the chair and start to carry out some form of dentistry. I'd say if you're not a people's person, you don't like talking too much with people, then stay well away from dentistry. I'd say if you don't like working with your hands too much, if you don't like problem solving, um, if you don't have very good patience levels, stay away from dentistry. But if what I'm saying is not putting you off, then I'd say definitely get some experience because it's a fantastic career. There's so much to dentistry. There's so many different aspects. You could be working with children as a pediatric dentist. You could be an orthodontist doing braces, straightening teeth for a living. You could be doing general dentistry, a little bit of everything. There's cosmetic aspects to it. There's the emergency side to it. We're very fortunate as professionals. We essentially are dental surgeons. We carry out hard and soft tissue surgery. So if blood doesn't freak you out, you may want to go and become more of a surgical dentist. And if blood bothers you, you may consider orthodontics or cosmetic dentistry, which is a little bit more cleaner. But definitely, first of all, get the experience, speak to more people, get different opinions. And one pitfall, one caution I'd say is please don't consider dentistry as a career if you think you're going to earn millions. It's really not about the money. Um, Not every dentist is rich, and the dental career should not be for the purposes of money. You should only do it for one reason, that's to help people. And if you want to help people and you want to have a wholesome career as a dentist, doing your bit to the level best that you can do, then it's a career for you. Dentistry will catch you out. If you think due to social media, what you're seeing, dentists are floating around fancy cars, private jets, and so on and so forth, it's not, that's not the reality. That's not the reality. You can speak to a lot of dentists. Not all of them are driving very fancy cars. We all work very hard. It's also important to tell you that dentistry is quite high up on the scales of professions that cause depression and suicide. It's always been very, very high in the rankings because it takes from you. It rewards you, but it takes from you. You have to give it your full. You've got to be fully engaged. When we carry out a dental procedure, which can range from 15 minutes to a few hours, we're fully engaged in the whole period. We're keeping our patient comfortable, communicating with them. Most of the time, it's non-verbal communication because they can't speak because we're in their mouth. And you've got to have a nice ambience in the room. You've got to have a nice atmosphere. You've got to get on with your dental nurse. You've got to be able to connect with the patient. You've got to go at their pace, not your own pace. And all these things come with time. And I definitely say that if you set off to become a dentist with the only one objective that you're going to make money, I don't think you'll become the best dentist there is, because you should do it because you're passionate about it. You want to learn about dentistry. You want to learn the art of dentistry. You want to excel. And if your objective is nothing but money, you'll never really reach those heights because it challenges you. And as soon as you're challenged, if your only purpose is money, I don't think you're going to excel. And I'd say there's plenty of other professions. There's money to be made in any profession. And I always advise do what you love the most. Do what you love. If you're going to go off and spend 3 to 5 years in university and then you're going to spend the rest of your working life in that profession, It has to be what you love. And I know this is very challenging, and very few of us are fortunate enough to do a career that we actually love, because then going to work does not feel like work. We go to work quite happy, really. We're looking forward to the next day. We look forward to seeing our day list. What does our week look like? What does the next week look like? And if you don't do what you love, ultimately, it's going to grind you down. And you're going to start to explore other options. And it's a long degree, it's 5 years. It's not something that, oh, it's just a year's quick course. And, if I don't like it, I'll do something else. And the course itself, the undergraduate degree or the postgraduate degree, super challenging, probably one of the toughest things I had to do in my life. So I'd say just take your time, consider your options, get lots of opinions. And if you're going to do it for the love of helping people. As a dentist, appreciate some oral medicine, appreciate oral health as a whole. Know yourself. Uh, can you communicate with people? Are you up for playing with different materials? Are you comfortable with holding a drill and operating on someone? You can give someone an injection and do it gently, and you know, um, have to deal with people that are in pain, possibly coming in tears, breaking bad news occasionally. Nobody likes to hear when they need a tooth out, or unfortunately, if they're suffering from oral cancer, it's one of the hardest things we have to do is to break bad news sometimes. So I'd say get plenty of advice and take your time. There's no rush. It's always better to take your time and hopefully engage with a career that's going to reward you, but you're also going to love as well.